Sometimes you just notice something a little different with your dog, don't you? Maybe they're straining a bit, or you saw a speck of blood, and
Mm,
suddenly you're down that internet rabbit hole trying to figure things out.
definitely happens.
Well, today on the deep dive, we're going to focus on one really, really common thing that can pop up, especially in older male dogs: benign prostatic hyperplasia,
Mm.
BPH.
Exactly. Yeah, we've been digging into some veterinary sources on this, and basically, BPH is an enlargement of the prostate gland in male dogs that happens as they get older.
Okay.
And the key thing right off the bat is that it's usually not painful for the dog,
That's good to know.
and it gets super common with age.
Right. So today, we kind of want to get a real handle on this.
Yeah.
What is BPH exactly?
Mm.
What's going on inside?
Uh-huh.
Which dogs tend to get it?
Hmm.
What signs might you actually see as an owner? And really importantly, what can be done?
Yeah.
The aim here is just clear, useful info, right? Without making it feel like reading a textbook.
Absolutely. Keep it digestible.
So let's start with the basics. What's actually happening in the body with BPH?
Okay, so essentially, the prostate gland just gets bigger. It happens sort of in two ways, or phases, the sources describe.
Phases, okay.
First, you get what they call the glandular phase. This is where the actual cells, the prostate cells, get larger, and that causes the whole gland to enlarge, but usually quite symmetrically, like evenly.
Got it. Even swelling.
Yeah. Then there's what's called the complex phase. This can involve, well, a mix of things, some areas of that glandular growth, maybe some areas of tissue breakdown or atrophy, sometimes little tiny cysts forming,
Oh, interesting.
and maybe some low-level chronic inflammation. So it's not just simple swelling, the tissue itself is changing.
Okay, so it's more involved than just like puffing up, actual tissue changes. But you stressed earlier, usually not painful.
That's the main takeaway for uncomplicated BPH, yeah. Usually non-painful, which is, a bit of a relief.
Definitely.
Right.
So who are we talking about here? Which dogs are most likely to get this? Is it only really senior dogs?
Well, that's one of the interesting things. BPH can actually start showing up relatively early. We're talking maybe even 1 or 2 years old in intact male dogs.
Really that young?
Yeah, but the chances, they just skyrocket with age. So by the time an unneutered male dog hits 6 years old,
Uh-huh.
a whopping 60% of them are estimated to have some degree of BPH.
60%. Wow.
And it gets even more dramatic. By age 9, it's something like 95% of intact male dogs.
95. Okay, that's
Yeah.
practically all of them.
Pretty much. It really shows how incredibly common this is if a dog isn't neutered. Almost inevitable, really.
So if you've got an older boy who's still intact, the odds are very high this might be happening, even if you haven't noticed anything. Which brings us to the next point. What would you notice? Are there clear signs?
Yeah, this is where it gets a bit tricky because the sources really emphasize that most dogs, they show no signs at all that the owner picks up on.
Ah, so it can be silent.
Very much so. But there are things that can happen, historically noted signs, like maybe a little bit of bloody discharge from the penis, or seeing blood in the urine itself, that's hematuria. Sometimes difficulty urinating, straining maybe, that's dysuria.
Right.
For breeding dogs, sometimes blood in the ejaculate is noticed, and then there's the effect on defecation, straining to poop. And sometimes this very specific sign, ribbon-like stools.
Ribbon-like. That paints a picture. So the prostate's literally squashing things back there.
Exactly. Anatomically, it sits right below the colon in the pelvic area. So if it gets big enough, it can press upwards and flatten the feces as they pass.
Makes perfect sense.
And then, on a physical exam, the vet would likely feel that enlarged prostate. But again, typically non-painful when they palpate it rectally.
Okay.
The key thing is, if there is pain when the vet examines the prostate, that's a red flag. It might mean something else is going on, like maybe a bacterial infection on top of the BPH, or less commonly, something like prostate cancer.
Got it. So usually no pain, enlarged gland, maybe some subtle bathroom changes, maybe a little blood. What's actually causing this enlargement? What are the risk factors?
It really boils down to hormones. Testosterone is the main player, along with a more potent form called 5-alpha-dihydrotestosterone. Estrogens play a role too, but it's mostly those androgens.
Hormones. Okay.
And of course, aging itself is a huge factor, as we saw with those prevalence numbers.
Right.
But here's the really crucial bit of info for owners. Castration, or neutering, completely eliminates the risk. If a dog is neutered, they don't develop BPH.
That's a A very definitive takeaway. If they're neutered, this isn't something you need to worry about.
Exactly.
Okay, so let's say a dog is showing some signs and the vet suspects something's up with the prostate. How did they figure out if it's just BPH or something else? What's that diagnostic process look like?
That's a great question because ruling out other things, the differential diagnosis is really key. Several conditions can mimic BPH or happen alongside it.
Right, like what?
Well, for instance, acute bacterial prostatitis. That's a sudden bacterial infection. It usually makes the dog feel pretty sick, maybe fever, they seem lethargic, definitely pain when the vet feels the prostate.
Okay, so more obvious signs of illness.
Yeah, and blood tests and urine tests would likely show signs of infection. And interestingly, like we touched on, this can happen at the same time as BPH.
Ah, so you could have both. What else?
Then there's chronic bacterial prostatitis. This is more of a grumbling long-term infection. Maybe the dog gets recurrent urinary tract infections, or if they're used for breeding, maybe subfertility.
Mm-hmm.
And again, this can also coexist with BPH.
Okay.
Then you have the more serious stuff like prostatic adenocarcinoma, that's prostate cancer.
Right.
Signs there might be more worrying, like weight loss, not eating well, maybe lameness if it spreads, and finding cancer cells would be the goal of diagnosis.
Definitely want to rule that out.
Absolutely. And finally, dogs can also get cysts on or near the prostate. Sometimes these get large enough that a vet might actually feel a fluid-filled mass in the abdomen.
Wow, okay. So, quite a few possibilities to sift through.
Yep.
What about the standard lab work, like blood tests, urine tests?
Yeah.
What do they typically show if it's just straightforward BPH?
Usually the good news is that the routine blood work, the CBC and the biochemistry panel comes back normal in uncomplicated BPH. Nothing really flags up there.
That's reassuring.
And the urinalysis, well, it might show blood, like we said, but importantly, you usually don't see lots of white blood cells or bacteria, which would point towards an infection.
Okay, so normal bloods, maybe blood in urine, but no infection signs.
Exactly. Unless, of course, one of those other conditions, like prostatitis, is happening concurrently.
Got it. So if the basic tests are pretty normal, but the vet still suspects BPH or wants to be sure, are there other, more specific tests?
Yeah, they can actually analyze the prostatic fluid itself.
How do they get that?
Sometimes through collecting ejaculate, or often by gently massaging the prostate during the rectal exam and collecting fluid that comes out the urethra. In BPH, this fluid might look clear or maybe a bit blood-tinged. You might see increased red blood cells under the microscope, but typically the white blood cell count is normal.
So no signs of inflammation there either.
Right. And if you culture the fluid, you shouldn't really grow significant bacteria unless there's also an infection present. There's also a blood test for an enzyme called serum prostatic esterase, which can be elevated, but it's maybe less commonly used.
Interesting. So direct fluid analysis helps. What about imaging, like X-rays or ultrasound? Can they see what's going on?
Oh, absolutely. Imaging is really helpful. Regular X-rays of the abdomen can often show that the prostate is enlarged, what vets call prostatomegaly.
Okay.
Sometimes they might do a contrast study called a retrograde urethrocystogram. They put dye into the bladder and urethra.
Ah, to see the outline.
Yeah, exactly. It can show if the urethra running through the prostate is narrowed or if dye actually refluxes back into the prostate ducts, which can happen with BPH.
I see.
But ultrasound. Ultrasound is probably the most useful imaging tool here.
Why is that?
Because it lets the vet really visualize the prostate itself. They can measure it accurately, see if the enlargement is symmetrical, check the texture. Usually it looks fairly uniform in BPH, and importantly, they can often see those little cysts inside the gland if they're present.
So much more detail than an X-ray.
Definitely. And crucially, ultrasound allows for guided sampling.
Sampling, you mean like a biopsy?
Sort of, but usually less invasive first. A fine needle aspirate, using the ultrasound image to guide a very thin needle into the prostate to collect cells.
Ah, okay.
And the sources say this technique is actually very accurate for diagnosing prostate issues, something like 80% accuracy. It helps differentiate BPH from, say, infection or cancer.
80% is pretty good.
Yeah.
Okay, so let's say all the tests point to BPH, diagnosis confirmed. What happens next? What are the treatment options?
Well, the first thing to remember is that if the dog has BPH, but isn't actually showing any clinical signs like they're peeing fine, pooping fine, no discharge, then treatment might not even be necessary. Just monitoring might be enough.
Oh, okay. So you don't always have to jump in and treat.
Not necessarily, no. But if treatment is needed because the dog is having symptoms,
Right,
then castration is considered the gold standard. It's the most effective treatment, and it prevents the BPH from coming back.
because it removes the hormonal stimulation.
Exactly. The sources do mention, though, that if there's also an active bacterial infection, the vet will usually want to treat that with antibiotics before doing the castration surgery.
Makes sense. Clear the infection first.
Yeah.
But what if, for whatever reason, an owner decides against castration? Are there medical options?
Yes, there are. If surgery isn't an option, medications can be used to shrink the prostate, at least temporarily.
Okay, like what?
The main one mentioned is a drug called finasteride. It works by blocking the conversion of testosterone to that more potent form, dihydrotestosterone.
Oh, okay. How's it given?
It's a pill given once a day, usually for several months, maybe up to 4 months, according to the sources.
Yeah, does it work well?
It generally does reduce prostate size. And interestingly, the sources note it doesn't seem to affect the dog's libido or semen quality and isn't linked to birth defects.
That's good to know. Any downsides?
The main one is that it's temporary. Once you stop the finasteride, the BPH is likely to come back. The prostate will enlarge again. The timing varies, but it's not a permanent fix like castration.
Right. So it manages symptoms but doesn't cure it long term. Are there other drugs?
There are a couple of others mentioned, yes. Hormonal drugs like magistral acetate, that's another oral medication usually given daily for a few weeks, and medroxyprogesterone, which is typically given as an injection that lasts longer.
Okay. Why might someone choose those over finasteride or vice versa?
Well, they work differently, but there are some significant potential downsides to be aware of with those last two.
Oh, like what?
For one, the sources strongly advise against using any estrogen-containing drugs, as they can have serious side effects, like bone marrow problems, and can actually cause unwanted changes in the prostate itself.
Okay, so avoid estrogens. What about the magistral or medroxyprogesterone?
The main concern highlighted is the risk of developing diabetes mellitus, especially with long-term use of either magistral acetate or medroxyprogesterone.
Diabetes. Wow, that's a serious potential side effect.
It really is. So while they are options, they need very careful consideration and discussion with the vet about the risks versus benefits, especially compared to finasteride or castration.
Definitely sounds like something to weigh carefully. So whether it's surgery or medication, what kind of follow-up can owners expect? How quickly do things change?
If a dog is castrated, the prostate shrinks pretty rapidly. The sources say you can expect about a 50% reduction in its volume within just 3 weeks.
That's quite fast.
It is. Shows how dependent it is on those hormones. With finasteride, as we said, it works while the dog is on it, but once stopped, the BPH tends to recur, although exactly when can differ between dogs.
Got it. So castration is quick and permanent reduction. Finasteride is temporary management.
That's a good summary, yeah.
Okay, well, this has been really informative. We've definitely dug into the weeds on BPH
We
today.
certainly have. I think the key takeaways are BPH is super common in older, unneutered male dogs.
Uh-huh.
Often there are no obvious signs.
Right. Silent condition a lot of the time.
But sometimes it can cause issues, urinary problems, straining to defecate, maybe that bloody discharge. Diagnosis means ruling out other possibilities, and castration is the most effective way to treat it and prevent it from coming back. But medical options like finasteride exist for temporary relief if surgery isn't chosen.
Absolutely. And, thinking about that incredibly high prevalence, 95% by age 9 in intact males, it really makes you pause, doesn't it?
It does.
What does that mean for the overall health and just well-being of our older dogs? And maybe what kind of proactive chats should you as an owner be having with your vet, about screening or preventative care for things like BPH, just to ensure your buddy has the best quality of life possible as they get older?
Yeah, that's a really good point. It's definitely food for thought.
Something to mull over, for sure.